Now, development rate. Definitely, Paul will be talking about it, but you should be having some idea. Right from our beginning of our life, we had three sets of kidneys. We begin with pro, meso, and metanephrons, and we settle with our lower one. Now, the kidneys are the structures which ascends. Testis and ovary are the structures who descends. On its pathway, the kidney takes, because it has variability, so it will settle accordingly. So in that context, well, I'm not touching upon the developmental details. We'll be learning them shortly. Now, talking about what is the location for a kidney, where we can find a kidney. We should expect a kidney from the back. Yesterday we were learning this was a structure who is present in the retroperitoneum. It's not a structure who lives anteriorly, it's a structure who lives behind the peritoneum. So it is present in the retroperitoneum. And we learned this thing yesterday that the right kidney is lower and then the left kidney. And why it is happening? Because the liver, the primary reason is the liver. Diaphragm is, plus minus. So liver is the main reason, and as you have done in your GI block, and I hope you'll remember it, the right lobe was enlarged and it was projecting downwards, so it was allowing lesser space for the right kidney. So that's why right kidney is slightly lower. But they had a range, and these kidneys, they move with our breathing activities. The kidneys, they move with each breath vertically, upwards and downwards. And their range of movement is around 2 centimeter, is the range where they ascend and descend. Now these kidneys, we talked about it yesterday, the best way to approach these kidneys if we approach them from the posterior side. Now, why that is the option? We can approach them from the anterior. There is no problem with that. But the idea behind the whole of this exercise is our destiny is what? To go to the kidney with minimal disturbances. If we approach from anterior part, through anterior abdominal wall, then probably once we'll try to approach the kidney from anterior, we will be interfering with intestine. Once we will be interfering with intestine, we'll also be interfering with the integrity of the peritoneum. We interfere with the peritoneum, there are certain issues which arise. Anybody who gets operation, no matter how clean, how sterile, how nice arrangements are, you get in, you are wearing gloves, always. They are made up of a chemical material. There are certain chemicals which are liberated, and these chemicals, they stays in the abdominal cavity, and in future they make certain reactions. Don't write these points, this is just for your understanding. They make adhesions, and that cause unnecessary problem in future. Sometimes some individual have some issues because we are manipulating the natural integrity, the natural environment of the intestine. We are interfering with that. We are pushing and pulling, and then we are cutting the posterior layer, the parietal layer of the peritoneum.